Hi, my name is Cord Honda. I'm a dermatologist and dermatopathologist at University Hospitals Cleveland Medical Center. I'm a professor of dermatology at Case Western Reserve University School of Medicine. Most commonly, we see teenagers who come in for treatment, but we do see some newer patients in young adulthood, sometimes in a little bit older than that, maybe early 30s, but most commonly, they'll come in their kind of mid-teenage years, and we'll follow them often through college and maybe into their early adulthood. Pimple patches are quite popular just in the past couple of years. It's something my daughters will also use. So it's very commonly used. That's the main thing that I've seen kind of change over time. No, I haven't noticed any differences. It's always been kind of standard. Usually people get it shortly after they hit puberty when their hormones are activated. That causes their sebaceous glands, those are the oil glands in our face, to enlarge and become more active. And that's a critical part of acne development. And so that's usually when we see them. And then most commonly we'll see mild acne, but sometimes we see moderate or more severe acne. Women, it can sometimes be related to their menstrual cycles, and that can have a hormonal component, which might require a little bit different treatment. But with both before there were pimple patches, that people would do spot treatment with benzoyl peroxide, and that's, I think, always been occurring. But the most important thing is to try to treat acne before it pops up to that stage. So it's better to start from the basics rather than going after it when it's already popped up. Yeah, mainly it's the spot treatment of acne. Again, people like to put things on their pimple outbreaks, thinking that will help. It might help resolve it a little bit, but you may still get the post-inflammatory hyperpigmentation or the darkening of the skin or scarring once the acne gets to that point. So it's better to treat acne before you can actually start to see it. So when people come with acne, we want to start to prevent the blackheads that lead to the whiteheads, and whiteheads are usually what people are seeing and putting their pimple patches on or their spot benzoyl peroxide treatment on. So it's much more important to treat it at that point. And also, we want to kind of control the acne before we go for any of the scarring or the residual of the acne, such as post-inflammatory hyperpigmentation. Yeah, definitely when for skincare, people sometimes think that their dirtiness of their skin is what leads to acne, and that's not true. It's just the stickiness of the skin cells and the oil glands that are active that lead to acne and some component of bacteria, but not dirt per se. So overwashing your face is not going to be helpful and can be quite irritating. The more products you put on, the higher risk there is for getting allergic reaction, not acne, but just irritation or allergic reactions to things. And what you put on your face, you want to be careful. That's not what is called comedogenic. That means it leads to what are called blackheads. Those are kind of the dilated hair follicles that are the initiating factor in acne, because things that block your pores can lead to buildup of the oil glands, the sebum, and blackheads and acne.